We're making important progress in our fight against the virus across 3 fronts: vaccinations, testing, and ensuring our response is equitable and reaches the hardest hit communities and those most at risk. On vaccinations, our program for kids ages 5 through 11 is hitting full strength this week, with 20,000 trusted and convenient locations coming online. This includes pediatricians and family doctors' offices, pharmacies, children's hospitals, community health centers, rural health clinics, and school-based clinics. While our program is just fully up and running this week, by the end of the day today, we estimate that over 900,000 kids ages 5 through 11 will have already gotten their first shot. And through pharmacies alone, 700,000 additional appointments are already on the calendar at local pharmacies. Parents and families across the country are breathing giant sighs of relief, and we are just getting started. We will continue to work with governors, local leaders, healthcare providers, and others to build on this progress. Minnesota has stood up more than 1,100 locations for parents to get their kids vaccinated, including at the Mall of America, which is the biggest mall in the country and now home to a site that can vaccinate 1,500 kids a day. Across the country, 114 children's hospitals are now offering vaccinations and engaging their communities, with many hosting family-friendly vaccination events featuring stickers, pets, and stuffed animals. We're helping states meet parents and kids where they are through FEMA-supported mobile clinics from Asheville, North Carolina to Florence, Oregon. And this week alone, New York City has over 1,000 clinics planned at schools, including early morning hour clinics before the work and school day begin. Next, in addition to the new program for kids ages 5 through 11, we remain focused on vaccinating unvaccinated individuals. Looking at the last 7 days alone, we're averaging about 300,000 first shots per day. That's the highest 7-day total in almost a month. The simple truth is that vaccination requirements are working. In fact, vaccination requirements have helped reduce the number of unvaccinated Americans ages 12 and older by almost 40%, from about 100 million in late July to under 60 million now. Vaccination requirements get more people vaccinated, strengthen our economy, and help continue us on our path out of the pandemic. Next, on booster shots, which add an important layer of protection. In total, over 25 million Americans have now rolled up their sleeve to get the enhanced protection of a Pfizer, Moderna, or J&J boost. So our boosters program is running strong. Stepping back across the past week, we've administered over 9 million total shots in arms. 9 million shots in arms. That's the highest one-week total since before the summer 5 months ago. It's clear that our efforts to help parents get their kids vaccinated, to vaccinate the unvaccinated, and to get boosters to eligible Americans are driving significant progress in our battle against the pandemic. Next, on testing. Today, we're taking another step to expand access to rapid diagnostic tests administered at doctors' offices, hospitals, and other healthcare settings. HHS is investing $650 million from the American Rescue Plan to provide manufacturers of point-of-care diagnostic tests advanced purchase commitments so that these manufacturers can scale up their production. Today's action builds on our $3 billion investment to increase the production of at-home tests, 4 new over-the-counter at-home tests authorized by the FDA since the start of October, as well as other actions by the FDA and NIH that will increase testing options and decrease prices for consumers. The bottom line, we've made significant progress on increasing overall testing capacity since late summer, including by quadrupling the available supply of at-home tests to over 200 million per month, starting next month. Last, on ensuring our response is equitable and reaches the hardest hit communities and those most at risk. On his first full day in office, the President took historic steps to center our COVID-19 response around equity, and he established the COVID-19 Health Equity Task Force. The President's leadership and our intentional, constant focus on equity has produced significant results. We've effectively closed gaps in adult vaccination rates by race and ethnicity. The most recent Kaiser Family Foundation survey showed that 73% of Black adults, 72% of white adults, and 70% of Hispanic adults had gotten at least their first shot by mid-October. We know we have more work to do, but this is significant progress we can build on. Earlier this morning, I received the final report from the COVID-19 Health Equity Task Force, which will help us do just that. The report includes recommendations on how we can continue mitigating health inequities caused by COVID-19 and further advance equity in our response. I want to thank the whole task force for their thoughtfulness and expertise in the development of this invaluable report. And I especially want to thank Dr. Nunez-Smith for her outstanding leadership. With that,